Welcome to another deep dive from Optic Surgeon. Today we're really getting into ocular discharge. We've looked at a lot of ophthalmic knowledge to help you figure out what different kinds of eye discharge might mean for a patient's condition.
It really is amazing, isn't it, how something like eye discharge, which seems simple, can point to so many different things. The key really is noticing the details.
Exactly. So let's start with something you might not immediately connect an eyelid twitch. Now, the twitch itself doesn't cause discharge, but, things associated with it, like corneal or conjunctival irritation or dry eye,
Hmm.
those can lead to watery or mucus discharge.
Right, you might think of just that little flicker, orbicularis myokymia, but also blepharospasm and definitely dry eye. It's interesting because any little disruption on the eye surface can set off a protective reflex. More tears, maybe mucus.
So even a minor twitch, if it causes some surface irritation, can kick that off.
Precisely.
Makes sense. Okay, what about when someone can't quite close their eyelids properly? Like ophthalmos, how does discharge fit in there?
Well, lagophthalmos means the eye surface is exposed, right? So it gets dry. And as we just said, dryness is a major trigger for discharge. Often watery at first as the eye tries to, make up for the lack of moisture.
And we see lagophthalmos in different scenarios, proptosis, ectropion.
Seventh nerve palsy, too, sometimes after cosmetic surgery even.
Yeah, it really shows how a physical issue with the eyelids directly impacts the tear film and can cause discharge.
So a key point for you listening, always check eyelid closure if someone presents with discharge. Incomplete closure could be a huge part of the story, especially if they also mention dry eye symptoms.
Good tip. Now, a really common complaint feeling like there's something in the eye. Foreign body sensation. That's strongly linked to discharge too, isn't it?
Oh, definitely. That gritty feeling. It triggers reflex tearing almost immediately. That's a type of discharge. And lots of things cause that feeling. It might be actual grit, or it could be dry eye again, blepharitis, conjunctivitis.
Even issues with contacts or maybe a loose suture post-op?
Exactly. So many possibilities leading to that same sensation and then the tearing response.
It really highlights the eye's defense mechanisms, doesn't it?
It does. And it means you really need to find the root cause of that sensation to treat the discharge properly. Careful examination is key.
Okay, let's shift to conjunctival swelling or ecchymosis. Looks quite traumatic sometimes. How does discharge relate?
Well, the ecchymosis is the swelling, but it often happens alongside conditions that also cause discharge. Think allergies, inflammation, maybe post-surgery. The same things causing the conjunctiva to swell can also stimulate more fluid production.
Right, and we sometimes see ecchymosis in less common things too, like venous congestion or angioneurotic edema.
Yes. So while the swelling might grab your attention, checking for any accompanying discharge gives you more clues about what's driving it.
The type of discharge could help differentiate.
It certainly can contribute to the picture.
Now, here's a bit of a paradox. Severe dryness, keratoconjunctivitis sicca, causing discharge. How does that work?
Yeah, it seems counterintuitive, doesn't it? But when the eye gets really, really dry and irritated, it can trigger this reflex tearing. The problem is these reflex tears are often just watery. They don't have the right lubricating stuff, so they don't actually fix the dryness.
So it becomes a vicious cycle. Dryness leads to irritation, which leads to watery discharge that doesn't help.
Exactly that. So a patient might complain of both dryness and excessive watering.
Good to know. So the watery nature of the discharge, plus the history of dryness, points towards that reflex mechanism.
Correct.
Okay, let's talk neurotrophic keratitis. Reduced corneal sensation. How does that lead indirectly to discharge?
Well, if the cornea can't feel properly, small injuries or irritations might go unnoticed. This can lead to significant dry eye or even worse, corneal ulcers developing. And those conditions, the severe dryness or an ulcer, can definitely cause discharge.
So the discharge could be watery from dryness, or maybe purulent if an ulcer gets infected.
Precisely. It depends on what secondary problem develops because of the poor sensation.
It's a good reminder that nerve issues can impact the surface and tear film.
And checking the history is crucial. Past eye surgeries, certain topical meds, conditions affecting nerves.
Got it. Superficial punctate keratopathy, SPK. Those little dots on the cornea. Discharge with that too.
Yes, SPK means the corneal surface is irregular, which causes irritation. And irritation often leads to, you guessed it, watery discharge. Reflex tearing again.
Okay. Infections. Big topic. Viral conjunctivitis. What's the classic discharge?
Typically watery, often quite profuse. And you'll usually see follicles on the conjunctiva too.
That helps distinguish it from bacterial, right? Which
Right.
tends to be thicker.
Generally, yes. Bacterial conjunctivitis is more often associated with mucopurulent discharge, thicker, maybe yellowish or greenish.
And we should remember, routine antibiotics usually aren't the way to go for viral cases, unless you suspect a secondary bacterial infection.
Absolutely. No point using antibiotics for a virus, and it contributes to resistance issues.
What about herpes simplex virus conjunctivitis? Is the discharge different there?
It can also be watery. Key things with HSV are that it's often unilateral, might recur, and you should look carefully for a follicular reaction and, importantly, any herpetic skin vesicles, little blisters, maybe on the eyelid or nearby skin.
So those skin signs are a big clue for herpes, even if the discharge looks just watery like other viral types.
Definitely, you need the whole clinical picture.
Okay, moving to something more serious. Bacterial keratitis. What discharge signals trouble there?
Bacterial keratitis often presents with a very painful red eye and typically purulent discharge. That thick, opaque discharge is a strong sign of corneal infection.
Purulent discharge equals likely bacterial infection. A real red flag.
A major red flag, yes. It means significant inflammation, bacteria, immune cells, requires urgent treatment.
And fungal keratitis, similar discharge.
It can be, yes. Fungal keratitis can also have significant discharge, often purulent as well. It can be really hard to tell fungal from bacterial just based on the discharge alone.
So cultures might be needed?
Often essential for diagnosis and proper treatment.
Then there's acanthamoeba keratitis. The contact lens connection is strong there. Discharge.
Yes, so acanthamoeba can cause significant pain, redness, and discharge. The discharge itself might vary, but the link to contact lens wear, especially with poor hygiene, and finding that characteristic ring infiltrate in the cornea are key pointers.
So any contact lens wearer with a painful red eye and discharge needs urgent assessment, thinking about bacterial, fungal, and acanthamoeba.
Absolutely critical.
Yeah.
And tell them to take their lenses out immediately if those symptoms start.
Okay, let's switch gears a bit. Dacryoadenitis, inflammation of the lacrimal gland itself. What about discharge?
With dacryoadenitis, you typically see pain, redness, swelling, usually in the upper outer eyelid area,
Right.
and often tearing or discharge. The discharge might start watery because the inflamed gland is just producing more tears.
So that specific location of swelling plus tearing or discharge points towards the lacrimal gland.
Correct. Often seen in younger people too.
Blepharitis, super common, chronic eyelid inflammation. What's the typical discharge picture?
Blepharitis usually causes irritation, redness, and that classic greasy or crusty discharge right along the eyelid margins. Patients often say their eyelids are stuck together in the morning.
Yeah, that greasy, crusty quality is pretty distinctive for blepharitis.
It's related to the inflammation messing with the meibomian glands, the oil glands and the lids.
Now, thinking about systemic connections, mucous membrane pemphigoid, the autoimmune condition.
Ocular cicatricial pemphigoid, yes. It can cause chronic conjunctivitis, and that inflammation can certainly lead to discharge. As scarring progresses, things might change, but ongoing inflammation often means some discharge.
And ocular rosacea, that can affect the eyes too. Discharge there.
Yes, ocular rosacea often causes blepharitis and sometimes keratitis. So you get the redness, irritation, and potential discharge associated with those, similar to other types of blepharitis or corneal irritation.
So with these systemic conditions, the discharge is part of a bigger picture, often involving skin or other findings.
Exactly. You need to consider the patient's overall health.
What about staphylococcal hypersensitivity? That can cause blepharocorroidal conjunctivitis with discharge.
Right. That's a chronic inflammation of the lids, cornea, and conjunctiva, driven by a reaction to staph bacteria.
The discharge can be mixed, maybe some greasy, crusty stuff like blepharitis, maybe some mucopurulent element from the conjunctivitis.
Interesting. And nutrition vitamin A deficiency, can that cause discharge?
Well, not directly, but severe vitamin A deficiency causes significant dryness, xerophthalmia, and potentially with toe spots. That severe dryness then leads to irritation and consequently secondary discharge, usually watery.
So it's the dryness from the deficiency that triggers the discharge.
Precisely.
Okay, allergic conjunctivitis. Many people know this one. What's the hallmark discharge?
Itching. That's the #1 symptom, but the discharge itself is often stringy, maybe watery or mucoid. That stringy consistency is quite characteristic.
Along with the redness and ecchymosis, yeah.
Absolutely. Intense itching, redness, swelling, and that stringy discharge highly suggestive of allergy. Superior limbic keratoconjunctivitis, SLK, another inflammatory one, discharge possible.
Yes, SLK typically presents with a red eye, burning, foreign body sensation, tearing, and sometimes a watery or maybe mucoid discharge.
What about scleritis and episcleritis? Inflammation of the sclera. mainly pain and redness, right?
Yeah.
Discharge common.
Scleritis, the deeper, more painful one, can sometimes have associated inflammation that leads to some secondary discharge. But scleritis, which is usually milder, more superficial, generally doesn't involve significant discharge.
So lots of discharge with that deep scleral pain might lean more towards scleritis,
It
perhaps.
could be a contributing sign, yes.
And we can't forget actual foreign bodies on the eye. They cause discharge, full stop.
Almost always, yes. The eye immediately tries to flush it out with tears, so you get reflex tearing, which is discharge,
A conjunctival laceration, a cut on the surface.
depending on how bad it is, yeah. You might
Yeah.
see some bleeding mixed with watery discharge from the irritation and the healing response.
Okay, nearly there. Tear drainage issues. A blocked nasolacrimal duct causes tearing, epiphora. Does it cause other discharge?
The blockage itself leads to the overflow tearing. But if that stagnant pool of tears in the lacrimal sac gets infected, that's dacry cystitis, and you can definitely see mucus or even purulent discharge being expressed from the punctum.
Ah, so infection adds the thicker discharge.
Correct.
And even something like congenital glaucoma. You mentioned tearing, photophobia, blepharospasm. Could that look like discharge?
It could be perceived that way, yes. It's primarily excessive tearing due to irritation and maybe the pressure effects, but the eye is constantly wet, which might seem like discharge to an observer.
And finally, just to round it off, adenoviral conjunctivitis. We said watery. How is chlamydial conjunctivitis different?
Chlamydial conjunctivitis tends to be more chronic, often with a follicular reaction like viral, but the discharge is frequently more mucopurulent. And you need to think about potential systemic involvement, too.
Wow, that's a lot of conditions linked to discharge. So, wrapping this up, what are the absolute key takeaways for you, our listener, when faced with a patient complaining of eye discharge?
Okay, I'd say focus on the type of discharge first. Is it watery, mucus, purulent, maybe stringy? That's a huge clue. Then consider the amount. And crucially, what are the accompanying symptoms? Is there pain, redness, itching, foreign body sensation? Has their vision changed?
And combine that with the exam findings, right? Looking for follicles, papillae, checking the cornea, feeling for lymph nodes near the ear.
Exactly. Put all those pieces together. And don't forget a detailed history. Ask about contact lens wear, any previous eye problems, their general health. It all helps narrow down the possibilities from that huge list we just went through.
That's a wrap for today's deep dive. I really hope that brought some clarity to your clinical thinking around ocular discharge. Until next time, stay focused, keep learning, and don't forget to subscribe for more from Optic Surgeon.